UK nations to provide targeted support for new arrivals, including English language tuition where necessary, or housing costs for those who will need it. We're creating 12 welcome hubs right across the UK to give practical support for everything from applying for a school place, registering with a GP, to setting up a business. This month, I met with 4 Hong Kong families who've recently arrived in the UK, and their profound sense of optimism about the future reaffirmed my belief that this programme will enrich our country for generations to come.
I'm sorry for the others who didn't get in, but unfortunately the question seemed to have taken a long time to answer. Now suspending the House for 3 minutes to enable the necessary arrangements to the next business. Thank you. Order. Order. I call the Secretary of State, Matt Hancock, to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. Mr. Speaker, this virus is diminished but not defeated. Cases, hospitalisations and deaths are back to the levels we saw in September. Throughout the crisis, we've protected the NHS, and there are now 2,186 people in hospital with COVID across the UK, down 94% from the peak. And the average number of daily deaths is 25, down 98%. Because of this brighter picture, we've been able to take step 2 on our roadmap, and it is brilliant to see the high streets bustling with life once again, and to hear the real-life crowd back in Wembley this weekend, especially if you're a Leicester City supporter. And now, with fewer COVID patients in hospital, the NHS is already turning to focus on the work to tackle the COVID backlog. Step by step, we're returning this country towards normal life, and we're on track to meet the roadmap set out by the Prime Minister. Last week we hit our target to offer a vaccine to priority groups 1 to 9, and we're on track to offer a vaccine to all adults by the end of July. But throughout we must be vigilant, cautious and careful, because we want this road to be a one-way street. Mr. Speaker, the uptake of the vaccine has been astonishingly high. For all over 50s, uptake is 94%. Enthusiasm among those in their late 40s was so high that when we opened up the booking system last week, they briefly overloaded the website. And we can see the result of this uptake in the real world. The latest data show that 98% of people aged between 70 and 84 now have COVID-19 antibodies, which are crucial to the body's ability to fight the disease. 98%. This is the protection our vaccination programme is spreading across the whole United Kingdom. Uptake amongst all ethnic minority groups continues to increase. PHE estimate that the vaccination programme has prevented over 10,000 deaths up to the end of March, and it will protect many, many more as the rollout continues. We know that the first dose gives significant protection, but the second dose is crucial to make people as safe as possible. On Friday and Saturday, we saw record numbers of second doses, over 499,000 on each day, and I'm delighted to tell the House that as of midnight last night, we've now given second doses to over 10 million people across the United Kingdom. 3/4 of over 75s have now had both jabs, rising to 4/5 of over 80s. Mr. Speaker, the vaccine is our way out of this pandemic, and I'm delighted that it's being taken up in such huge numbers. We'll do everything in our power to drive uptake, especially when it comes to protecting the most vulnerable. And the vaccination rate amongst care home staff is currently below 80% in over half of all local authority areas. Many care homes have called for vaccinations to be required for those who work in these settings. We have therefore launched a consultation into whether we should require care home providers that care for older adults to deploy only workers who've received their COVID-19 vaccination unless they have a medical exemption. We all know that older people living in care homes are at the greatest risk from this virus, and I believe we have a duty of care to protect the most vulnerable, so we'll consider all options to keep people safe. Mr. Speaker, as we deliver on stage 2 of the vaccination programme to vaccinate all remaining adults in the UK, we must also turn our attention to what comes next. The biggest risk to our progress here in the UK is a new variant that the vaccine does not work as well against. We know from our response to other viruses like flu that we need updated vaccines to tackle mutated viruses. So I can tell the House that as we complete the programme of first and second jabs, we're ramping up plans for a booster shot to make sure our vaccines stay ahead of the virus. We've already procured enough vaccine doses to begin the booster shots later this year. We'll be working with our current vaccine suppliers and new suppliers like the CureVac partnership to work out which vaccines will be effective as a booster shot and to design new vaccines specifically targeted at the variants of concern like the variant first found in South Africa. Our goal is to ensure the vaccine protects against this dreadful disease, whatever it throws at us, to keep us safe and protect our much-cherished return to a normal way of life. Mr. Speaker, the booster shot is important because it will help protect against new variants. Until then, we must remain vigilant in case a new variant renders the vaccines less protective, because new variants can jeopardise the progress that we've made here in the UK. Thanks to our early investment in COVID genomic sequencing, we have in this country one of the best systems to spot and suppress new variants wherever we find them through a combination of tough measures at the border, our genomic sequencing capability, and our massive testing system. Mr. Speaker, I'd like to inform the House of another new development in our testing system. We've been piloting Pharmacy Collect, which is a system in which you can go and pick up tests for free from a pharmacy. And I'm delighted to tell you that following the successful pilot, we have now rolled out Pharmacy Collect to over 9 in 10 pharmacies, meaning that The universal testing offer, in which anyone can get tested up to twice a week, is now free and easily accessible to anyone who wants it. You just have to go to your local pharmacy, sir. Mr. Speaker, I'd also like to update the House on our response to two new variants. One, the variant of concern first identified in South Africa. We've now detected a total of 557 cases of this variant since it was first identified in December. We've seen a cluster of cases in South London, predominantly in the London boroughs of Wandsworth, Lambeth and Southwark, and identified single cases over the last week in Barnet, Birmingham and Sandwell. Around 2/3 of these cases are related to international travel and have been picked up by the Day 2 and Day 8 testing for international arrivals. However, we have seen a small amount of community transmission too. As soon as these cases are discovered, we acted quickly to put in place enhanced testing, tracing and sequencing. In Lambeth and Wandsworth, we've brought in 19 mobile testing units in our largest surge testing operation to date, and that we're distributing test kits to housing estates, secondary schools, places of worship and workplaces. I'd urge everyone who lives in these areas, whether you have symptoms or not, to get tested regularly and help us to keep this variant under control. 2. We've recently seen a new variant first identified in India. We've now detected 103 cases of this variant, of which, again, the vast majority have links to international travel and have been picked up by our testing at the border. We've been analysing samples from these cases to see if this variant has any concerning characteristics like greater transmissibility or resistance to treatments and vaccines, meaning that it needs to be listed as a variant of concern. Mr. Speaker, after studying the data and on a precautionary basis, we've made the difficult but vital decision to add India to the red list. This means anyone who is not a UK or Irish resident or a British citizen cannot enter the UK if they have been in India in the previous 10 days. UK and Irish residents and British citizens who've been in India in the past 10 days before their arrival will need to complete hotel quarantine for 10 days from the time of arrival. These rules will come into force at 4 a.m. on Friday. Mr. Speaker, India is a country I know well and love. Between our two countries, we have ties of friendship and family. I understand the impact of this decision, but I hope that the House will concur that we must act, because we must protect the progress that we've made in this country in tackling this awful disease. Mr. Speaker, another way that we've kept the country safe is through maintaining a strong supply of PPE. At a time of massive global demand, we secured supply lines, created a stockpile to see us through the winter, and created onshore manufacturing capacity here in the UK. And I'm pleased to inform the House that since February last year, we've now distributed over 10 billion items of PPE to protect people working in the NHS, in social care and in public service right across the country. Delivering so much PPE at such speed and scale has been an extraordinary effort that has not only helped us through the crisis, but given a lasting legacy for the future. If I may, Mr. Speaker, two further points. I'd like to inform the House that today we have appointed Professor Lucy Chappell as the Chief Scientific Advisor to the Department for Health and Social Care. Professor Chappell has a stellar track record in science and research, including leading on the work on vaccinations in pregnancy. And she's worked very closely with our National Institute for Health Research, for which she will now be responsible. I'm sure the whole House will join me in congratulating Professor Chappell on her appointment. And finally, Mr. Speaker, last month we laid before the House our one-year status report on the Coronavirus Act. I'm sorry to say that the report contains an error relating to Section 24 of the Act concerning Home Office measures on data held for national security purposes. Full details are set out in a written ministerial statement being laid today. The error doesn't change the substance of the report, as we'll be laying the regulations to expire Section 24 alongside other provisions as soon as parliamentary time allows. Mr. Speaker, in summary, we are moving down our road to recovery. Vaccinations are rising, the pressure on our NHS is falling, and as we enjoy the freedoms that are returning, let's take each step safely. We must hold our nerve, follow the rules, while the vaccinators do their vital work, and I commend this statement to the House.
Secretary of State Jonathan Ashworth.
Thank you, Mr Speaker, and I thank the Secretary of State for advance sight of his statement. Can I start by saying I'm sure I have no doubt that the Downing Street was reluctant to cancel the Prime Minister's trip to India, but as a member for Leicester, I'm immensely proud of our deep ties and bonds with India, but I think in the circumstances it was the correct thing to do, because we must always be vigilant, we always must be driven by the data, and of course the variants are the biggest threat to our progress. Tackling these variants does demand that vaccination continues to be rolled out successfully, and I again pay tribute to all involved in that. But of course, uptake levels, although improving, as he said in his statement, are still too low in some minority ethnic communities. So will he provide extra resources to those local communities who need them to drive up those vaccination rates? We will look carefully at his details for vaccinating social care staff, but he will know, of course, that every attempt throughout history to force mandatory vaccination has proved counterproductive. Why does he think this will be any different? And of course, even with high levels of vaccination across the population, there will be significant parts of the population unvaccinated, children, for example. So the virus will be endemic, as the Chief Medical Officer has recently confirmed. SAGE's papers model a third wave this summer. So how do we avoid that third wave this summer? And can I suggest to him that one way we could do that is to pay higher sick pay and expand its scope. Some of the poorest and the lowest paid will continue to suffer and be left exposed to this virus unless we fix this. We shouldn't just glibly accept these health inequities. It could mean urban areas left behind, remaining with restrictions and higher infection rates as well. So for the millionth time of asking, will he please fix sick pay? Now, coming on to India, India has the most cases in the world at the moment. I think more than around 250,000 confirmed cases a day and going up. This is one of the world's steepest surges right now. And uploads of Indian sequencing to the Global Open Access database show the new double mutant of B1617 variant becoming dominant in India in the past few weeks, outcompeting our own homegrown Kent strain. And as of today, UK COG reports 135 cases of B1617 in the UK, 115 in the last 28 days, the fastest growing variant in the UK in the last 3 weeks. If most of those are imported, so we welcome his announcement about adding India to the red list, although I hope there will be support and help in place for constituents like mine who are legally in India and will want to return. But we also now have cases in the community not linked to international travel. Now, I understand that he is carrying out analysis of those samples, but surely we now need to start surge testing and designate B1617 as a variant of concern. Because how long will it take before more definitive evidence that it is more infectious or has immune escape, how long will it take before we know that? Because we already know that this variant carries mutations of concern in other variants. And if we have learned anything in the past 12 months, is that this virus ruthlessly exploits ambiguities, that we must act fast when the situation is controllable, because in a few weeks' time, it might not be. Now, he didn't mention vaccine passports in his statement. And does he anticipate that vaccine passports will soon be needed for football games or concerts? Because, if I may, Mr. Speaker, and as he said, Leicester City have indeed made it to the FA Cup final, and they are a team challenging for Europe on merit, Mr. Speaker, who always put fans first. But many who are anticipating going to a football match later this year will be asking if they need a vaccine passport, will it be based on 1 dose or 2? He may have seen data from the Centre for Disease Control in the US or Israel that suggests that you are still infectious after 1 vaccine dose. So can he update us on that front? And finally, Mr. Speaker, on the latest Sunday Times revelations about Greenhill's and Cameron's lobbying of him and the various highest NHS officials about the payday financing scheme, which wasn't an act of altruism to staff in a pandemic, but an investment plan to package up loans to sell to investors, with the former Prime Minister, not nurses, in line for a payday windfall. Cameron wrote in one of his emails, quotes, "As you can imagine, Matt Hancock is extremely positive about this innovative offer. They sought a partnership with NHS Shared Business Services, which is of course jointly owned by the department. They sought access to personal and financial data of thousands of NHS staff. They wanted their electronic records for their own commercial gain. And their plan was to expand into the social care sector as well, where staff are low paid, are on 0 hours contracts, and because the market is fragmented and made up of private providers, the supposed non-profit offer would not apply, presumably. There are meetings and communications with a parade of the most senior NHS officials, including former Health Minister Lord Pryor and Baroness Harding. At least 30 trusts may have spent valuable time considering the adoption of this untested payday lending scheme, and all because the Secretary of State succumbed to his old boss Cameron's lobbying. So again I ask him, will he publish all the text messages, all the emails, all the correspondence with David Cameron? Can he tell us how many NHS leaders and officials did Cameron and Greensill lobby and meet? How many NHS trusts in total were approached about this expensive, unneeded scheme? And while we're on it, on the issue of shared business services, can he also tell us why he never declared his own links to Topwood, the confidential document shredding firm, who were still on Friday night, until it was curiously taken down, using the NHS logo on their website to promote themselves? With so many accusations and allegations of sleaze and cronyism, these are basic questions that deserve clear answers. Mr. Speaker, NHS staff deserve a pay rise and support, not these payday loan apps, forced on the NHS by speculators trying to make money out of the pandemic. How can he possibly defend it?
Thank you very much, Mr. Speaker. If I just address the final point first, as I said to the House last week, my approach was and is that local NHS employers are best placed to decide whether to take up offers of pay flexibilities. And when it comes to NHS shared business services, ministers are not involved in decision-taking in NHS shared business services. And when it comes to the other matter that he raised in terms of my declarations, which are only known to him and to everybody else because I followed the rules in letter and spirit and made that declaration, I rather agree with the Leader of the Opposition rather than the Right Honourable Gentleman, who said that he was not suggesting that any rules were broken. If I now turn to the COVID-related matters, I welcome his support for the decision to put India on the red list. This isn't a decision that we take lightly. He's right to ask about surge testing to make sure that we limit the spread as much as is possible of the variant first found in India, and we will be doing that, I can confirm. I welcome his support for vaccinations, which he has demonstrated at all turns. And I think it's partly because of this unanimity across this House, which includes all parties, about the importance of vaccination, that we have this absolutely spectacular level of uptake. He says that every attempt at mandatory vaccination is counterproductive. I gently point him to the fact that surgeons need to have a vaccine against hepatitis B, and so vaccination that is tied to work, in fact, has a long-standing precedence in this country. He asks many questions about certification, but he knows that there's a review of certification that's underway at the moment, being led by my right honourable friend, the Chancellor of the Duchy of Lancaster, and I'm sure that the Chancellor of the Duchy will have heard his representation and questions and will be able to address them in that review. And finally, he says that we must avoid a third wave by sticking to the rules. And he's right. We should avoid a third wave if we can. And the way we can do it is by sticking to the rules and getting the jab. That's why this vaccination programme is so important. It's why the roadmap is cautious and we hope irreversible. That is the plan. And with the 10 million second vaccines and the progress in the vaccination programme that we've seen in the last few days, weeks, and indeed months, I'm very pleased to say that we're on track.
Select Committee, Jeremy Hunt.
Mr. Speaker, it's a pleasure to see you face to face after some time, and the Health Secretary is absolutely right to put India on the red list, and absolutely right to explore mandatory vaccination of certain frontline workers, however difficult and sensitive that decision may be. But he will know in the last week we've seen that NHS waiting lists have risen to nearly 5 million people, nearly 1 in 12 of the population of England, the true cost of the pandemic. But it's equally true that we've had capacity problems in the NHS for some time. So that's partly why we've opened 5 new medical schools. But does he agree with the letter that he's recently received from the 3 main health think tanks that say that Health Education England should be given a statutory duty to publish regular, transparent, independent, objective workforce projections so we can actually make sure we really are training enough doctors and nurses? This is an approach strongly supported by the Select Committee and by the Academy of Medical Royal Colleges. I hope he will support it too.
Thank you very much, Mr. Speaker. Well, we'll certainly consider that. I've seen the letter. We've discussed the question. But I would also also add that we have a record number of doctors in this country, in part thanks to the work that my right honourable friend put in place when he was in my shoes. We have a record number of nurses, over 300,000 for the first time in the history of the NHS. So we do need, of course, to look to the future and make sure that we're preparing for the future, as the letter suggests. We also need to make sure we keep driving this project of delivering 50,000 more nurses into the NHS over this Parliament right now. So I look forward to having a more substantive response to my right honourable friend, but I can hear his encouragement to make sure that we take steps in this direction.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you very much, Mr. Speaker. While the vaccine programmes across the UK are going well, vaccine-resistant variants remain a major threat. I welcome that the Prime Minister has now called off his visit to India due to their devastating surge in COVID. Cases of the B1617 Indian variant in the UK are still very low, but it has been doubling every week despite lockdown, suggesting that, like the Kent variant, it is much more infectious than the original. I therefore welcome that India is being added to the red list to reduce further importation. But will he not now consider extending hotel quarantine to all arrivals, as travellers from red list countries can currently avoid it by coming via a third country? We've already seen increased numbers of the South African and Brazilian variants in European countries, from where travellers are not placed in hotel quarantine. And more infectious or vaccine-resistant variants could emerge in any country, and we simply wouldn't know about it until it's too late. The pandemic is still accelerating, and as well as causing appalling suffering and death in other countries, it clearly poses a threat to the people of the UK. So does he not recognise the need for a more cooperative global response to COVID if we are to bring the pandemic under control and allow a safer return to international travel and commerce?
Thank you very much, Mr. Speaker. Well, I certainly agree with the Honourable Lady on the final point, and it is a point on international collaboration and work together that, along with the Foreign Secretary and the Prime Minister, we are working incredibly hard on, and using the UK's presidency of the G7 and the enthusiasm of the new administration in Washington to try to drive that international collaboration, and in particular collaboration amongst like-minded democracies in favour of an open and transparent, science-led response to pandemics. And I hope that she'll concur with that approach. When it comes to the new variants of concern, of course, when looking at the numbers, it is very important to distinguish between community spread and spread connected to travel. By taking the action that I've just announced to put India on the red list, we are, of course, restricting yet further the likelihood of incursion from India of somebody with a new variant. But the majority of the cases that we have seen already in this country have been picked up by the testing that we have in place now for every single passenger entering this country, and so that is a sign of the system working and is now being strengthened.
Let's go to Bob Blackman. Bob.
Thank you very much, Mr. Speaker. And I'm delighted to say that I've had my second dose of Oxford AstraZeneca vaccine, and so far, no ill effects. But can I also ask my right honourable friend, in Harrow, we've had surge testing, particularly because we've had a relatively small number of the South African variants discovered. Literally thousands of people have been tested. But one of the most frustrating things is these tests then have to be sent off, and there appears to be an extremely long turnaround time before we get the results of those tests. What can he do, therefore, to speed up the results of getting these tests? Because otherwise, people aren't aware of whether they've got the variant or whether they should take particular action.
Mr. Speaker, he's absolutely right to raise this important issue. And I know that representing a very significant number of constituents from the Indian diaspora, I know that this is an important announcement for him and his constituents. What I'd say in terms of the turnaround time is we have managed to reduce somewhat the turnaround time for the sequencing of positive tests, but we are also introducing a new type of test which can detect not just whether you're positive, but whether you have one of the known variants without having to go through a full sequence. And that can give you a snapshot much, much faster within a matter of hours as to whether a positive result has one of the known variants before sending it off to sequencing so that you can see any new variant that you don't know about. So we are introducing that technology. It's starting in the Lighthouse Lab, the testing facility in Glasgow. We're rolling this out across the system. It's an important tool to make sure we can get this turnaround time of spotting the variants down faster.
Mr. Carmichael.
Thank you very much, Mr. Speaker. Can I say to the Secretary of State, it is quite astonishing that his statement today had absolutely nothing to say about the government's plans for vaccine ID cards, which apparently is something that's being trialled. Just last week, the Equality and Human Rights Commission told us that vaccine ID cards and possibly even the mandatory vaccination scheme that the Minister is trumpeting today could be unlawful. But yet this House has had no opportunity to express a view of them at all. When is the government going to share and come clean with their plans for vaccine ID cards with this House?
I refer the right honourable gentleman to my previous answer, which is that the Chancellor of the Duchy of Lancaster is leading a review into this area, which will report in due course.
Pauline Latham.
Thank you, Mr. Speaker. Can I congratulate my right honourable friend on the phenomenal rollout of the vaccine programme? It's been astonishing, and I also have had my second vaccine, which makes me feel much happier. We've been told regularly that we are following the data, not the dates. But sadly, it seems to be the other way around, that we are following the dates and not the data, because we know, for instance, in Derbyshire, there are huge swathes of villages and towns that have no COVID whatsoever. And that's repeated over all sorts of areas of the country. Last week, I managed to go out several nights because I could, which was great, and the atmosphere was fantastic. But we do need to start getting businesses back to normal. We need to get hospitality businesses operating fully functioning and using their indoor spaces. Some of the outdoor spaces I've been in are quite enclosed. So can we not go indoors as well now?
Well, I'm absolutely delighted that my honourable friend, like my honourable friend, the member for Harrow, they are both 1 in 10 million having had their second jab, and it's really, really good to see the hope that the vaccine brings and the cheer. And that links to her second part of her question about the speed of the roadmap. The reason for the timing set out in the roadmap is that we want to see the impact of one step before we then take the next step. We are but 1 week on since we took the took step 2. That is a significant reopening, and we've all seen it, no doubt, in our constituencies. We've seen it around the country. And we want to see the impact of that on the data before taking the next step, so that we can have confidence that this is an irreversible path, a one-way street, as I put it. That's the reason for the way that we've set it out, and that's how we're planning to proceed.
Jim Shell.
Well, excuse me, Mr. Speaker, I just wasn't concentrating the way I should have been. Minister, I also, along with others, welcome the rollout of the vaccine and the importance of it. But at the same time, Minister, Secretary of State, they were feeling now it's now time to look at the waiting list, and I put one on record. What steps have taken place to get routine operations such as hip replacements and tonsil operations back on the table to address the waiting lists that are eye-watering and vastly concerning? When we hear of children on an urgent waiting list for tonsils and adenoids to be removed last year, but due to dips in oxygen levels, which were considered urgent at that time, but now appear to be okay. Very, very worrying, Secretary of State.
Thank you very much. My honourable friend raises an incredibly important point, because this waiting list is very significant. It's built up because of COVID, but we must tackle it. We're absolutely determined to. And he, like me, will have seen the figures last week in terms of the increase in the waiting list in England, but the waiting list has increased in all parts of the UK. We've put in extra funding. In total, for next year, it's an extra £7 billion of funding in England, with the Barnett consequentials in the three that's gone to the 3 devolved administrations, and that is there to make sure that we can get through this backlog, whilst also, of course, dealing with COVID and the infection prevention and control that's needed to tackle COVID. So this is it's a vital task. He's quite right to raise it, and it's something we're working on very hard.
Thank you, Mr. Speaker. My right honourable friend is rightly proud of the stunning performance of the vaccination teams around the country, and of course I pay tribute to those who've been engaged in that in and around Ashford. I'm sure he agrees with me that it's particularly important for care workers to be vaccinated, not just care home workers, but domiciliary care workers who go from house to house providing essential care as well. So could he say what he's doing to encourage take-up among those care workers to get as close to 100% as possible?
Yes, it's incredibly important that all care workers take up the jab if they possibly can, unless they have a vital medical reason not to. Because the jab, of course, not only protects you, but it protects people you're close to. And if you are a care worker, that means you are close to people who are vulnerable. That's in the nature of the job. That's why I think it's right to consider within care homes, saying that you can only be deployed in a care home if you have had the jab. And we're looking into that. We have not said that for those who work in domiciliary care, in caring for people in their own homes rather than in a care home, because it is those in care homes who are the highest risk of all. But I would absolutely urge anybody who is a carer and works, whether they work in social care or an unpaid carer, if they haven't already got the jab, then please do get the jab, not just to protect you, but to protect those over whom you have a duty of care.
Let's go to Debbie Abrahams. Debbie.
Thank you, Mr. Speaker. Mr. Speaker, as the UK rolls back lockdown restrictions, the global death toll has reached 3 million. And the World Health Organization is warning that the world is approaching the highest rate of infection so far. With 3 new variants on 3 continents, all of these variants now in the UK reduce efficacy of the different COVID vaccinations against these variants, it is clear that the UK's success in fully emerging from this pandemic is codependent on how well the rest of the world is doing. I asked the Health Secretary about global coordination of surveillance of new variants back in February, and the World Health Organization is now consulting on this. So can the Health Secretary update the House on our response to this consultation?
Yes, this is an incredibly important subject, and I agree with the substance of what the Honourable Lady asked in the question. She's quite right to raise this. We've put in place the new variant assessment platform, allowing any country around the world to use our enormous genomic sequencing capability if they want to sequence positive cases in order to discover what is happening in their countries, but also our borders testing system, where all positives are sequenced, means that we in fact get a survey from around the world through those who have travelled to the UK, and we can relay that data back to individual countries so that they understand that better. Of course, it would be far better if something like the new variant assessment platform is run on a multilateral basis globally, for instance by an organisation like the WHO. We are engaged with the WHO on making sure that is available, but my view was we needed to get on and offer it to everybody and then build a network of labs around the world which can make that offer so that sequencing can be available in every country, because it is currently far too patchy.
Let's go to Harriet Baldwin. Harriet.
Thank you, Mr. Speaker, and can I add my congratulations to the team that's managed to give 2 vaccinations to over 10 million people. That's fantastic news. And given the risk of variants, I do welcome the difficult decision that he has made to add India to the red list. Can I ask the Secretary of State what research he has commissioned into those people who have, like my honourable friends, had 2 vaccinations, and what possibility there might be that people who have had 2 vaccinations are able to go about their daily lives with fewer restrictions than those who have not?
Thank you very much. Well, that latter question is really a question tied to the certification work. We have not hitherto, as she well knows, said that rules should be different for people who are vaccinated as non-vaccinated, but we know that some other countries are proposing to say that that will be the case for international travel, so we do need to have a way of showing that, of proving that. But we have not yet to come to any conclusions about how we should do that and whether we should do that domestically. That is a matter for the Chancellor of the Duchy of Lancaster. But in terms of measuring how effective a second dose is, we have tests in the field right now to follow a sample of people who've had both tests, to have them tested regularly, weekly, typically, to then be able to check whether or not they test positive and therefore test the effectiveness of both of the vaccines in the field. So far, we've published the results of that after 1 jab, and very early results are coming through after 2 jabs, and in the next couple of weeks we'll have some really rich data, I should hope, on that, because we've now seen a very significant proportion, a number of second jabs, 10 million as of midnight last night.
Let's go to Fariel Clark. Fariel.
Thank you, Mr. Speaker. Mr. Speaker, the vaccination rollout for the majority of the country has been nothing short of amazing. And I would like to thank the local NHS providers in Enfield and across the country for their Herculean efforts. Sadly, for some parts of the country, including many parts of my constituency of Enfield North, a postcode lottery appears to be emerging, where vaccination rates are stubbornly low and falling behind the rest of the country. What is being done to combat this, and what additional support will his department be providing